So appreciate the introduction. We're happy to be here. We are all from Hegira Health. We're a large behavioral health organization in Western Wayne County, and Melissa's going to talk a little bit more about Hegira when it's her turn. What I'm going to focus on is just the impact of COVID-19 on substance use disorders and the use of drugs and alcohol, as well as the substance use impact on COVID-19. So I wanted to start out just talking a little bit about why do people use drugs? Well, and these are very general reasons. They're more individualized. When you talk to people, individuals, it's more specific to them. But these are just general reasons why people use drugs and alcohol. And so some of them are depression, to cope, to escape feelings, to escape memories, to escape just unhealthy situations or what have you, boredom, stress, grief. Illness. So there's a lot of different reasons why people use drugs and alcohol, and COVID has certainly had an impact on all of that. So one of the things that when you start, I wanted to find some research and look at really what impact has COVID had on everybody and their emotional and their mental health. So this is one study, and it was done in October of 2020, and it involved college students. And they asked these students a bunch of questions, and one of them was, how would you say your emotional health has been impacted compared to before the COVID-19 outbreak? And as you can see, is 62% of those folks said that it's either somewhat worse than before or far worse than before. So you can see that obviously the toll that it's taken on all of us has it's been a major impact on all of us in our emotional health and our mental health. Through isolation and separation from everybody. We were talking earlier about giving ourselves hugs versus giving other people hugs. It's been a tough time the last year and a half for everybody. This is the same study and just a different question. Which of the following mental or emotional challenges have you experienced in the past month? And you can see a majority of the people said things like anxiety, social isolation or loneliness, depression, difficulty coping with stress. And even though they're smaller percentages, there's still a lot of concerning things on here, suicidal thoughts, and Melissa's going to talk a little bit more about that, substance use issues, a lot of impact that COVID-19 has had on all of us. Another study looked at anxiety disorder and depressive disorder in adults, and this study looked at folks in January through June of 2019, and 11% said that they had anxiety or depressive disorders. January 21. Now it's up to 41%. So a 30% increase in those people feeling that they have again, they're struggling with anxiety, they're struggling with depression. And again, there's a lot of reasons for that with COVID. People struggle with it beforehand, but COVID has just really intensified all those feelings and the fear of getting sick to being separated from everybody, from loved ones. Whether it be young people or old people, older people who have been in nursing homes or what have you, there's been such an impact on the separation, not being able to be together and be social and go to social events, whether it be go out to dinner or go to a support group face to face or anything like that. And so all these have really intensified these emotional and mental health issues. And so when you go back to why do people take drugs, when you start looking at these again, depression was there before, but now it's more intensified. Now more people are experiencing depression. Looking at to escape, boredom, social isolation or loneliness was one of the higher percentages on that question. So again, that boredom goes from boredom to being lonely to be isolated from others. Stress of the whole everything. Might be a job loss, might be just other things that we've lost with COVID. And it's not just the people who get sick, it's the loved ones of those people as well, and the loss that they've experienced and the stress that they've experienced. Then you're going to see an increase in substances. If you use because of depression, loneliness, boredom, to escape, and then those are more intense now, the substance use is going to become more intense. And so this was a study where these folks looked at results of urine drug analysis and found just positivity rate for cocaine, fentanyl, heroin, and methamphetamine. And what they found was that you can see as of March 13th, 2020, when the national emergency, the declaration of the national emergency for COVID, you can see a spike in substance use right away. which again makes sense. If that anxiety is increasing, that depression's increasing, that loneliness is increasing, these are the ways that that some people deal with those emotions and those situations. And so as those intensify, the substance use intensifies. And so we've seen a big leap in that. And while certainly, and especially in March, April, and May, when the stay-at-home orders were there, and we weren't going out or doing anything. You were basically stuck in your home for most of the time. And some people literally stuck in their home. They literally couldn't leave because of fear of getting sick, or because they were sick, or what have you, because they have all the risk factors that put them at a higher risk of getting COVID. And even though the numbers look in these graphs, some of them start going down, it's still higher than what it was before. And so not only does COVID have an impact on substance use, but substance use has had an impact on COVID. And so this is a study that was done where they looked at comparing people with a lifetime use of substances and recent use of substances. And the impact that had on contracting COVID-19. And what they found is that people with a substance use disorder at any time in their lives were 1.5 times more likely to contract COVID-19 than those without a substance use disorder. So the substance, if their use of substances made them more susceptible to acquiring COVID-19. Those with a recent substance use disorder are more than 8 times more likely. So if which makes sense. More recent means you're going to have more physical impact, physical effects from the substances. And so, again, you're going to be more susceptible to obtaining COVID at that point. People with an opioid use disorder are a particular high risk for COVID, and we're going to talk about that in a minute. And then COVID-19 patients, with substance use disorders are more likely to require hospitalization and to die from COVID-19 than those without an SUD. So why is that? So they started looking at that. And so this is the same study. And the first set of bars you see are all COVID-19 patients. So they just looked at patients with COVID-19. Those patients that had a lifetime substance use disorder, those patients that had a recent substance use disorder. So lifetime being they had an addiction or used substances a while ago. Recent is obviously more recent. What they found that more than 40% of the COVID-19 patients with a lifetime or recent SUD diagnosis required hospitalization, compared to 30% among all COVID-19 patients. So they're more likely, if they have a substance use diagnosis, they were 10% more likely, or 10% more of them required hospitalization. 10% of COVID-19 patients with an SUD diagnosis died, compared to 7% of all study patients. And while we say, well, maybe 3% isn't that much, when you think about how many people have contracted COVID-19, that's a high number. Even that 3% is a high number of people. What was also interesting is hospital and death rates did not differ between lifetime SUD diagnosis and recent substance use disorder diagnosis, meaning that use of substances has a major impact and made them more susceptible to COVID-19. So, it didn't really matter if it was recent or 10 years ago or 20 years ago, they were more susceptible to it. So why is that?